The Department of Public Health used its portion of CARES Act funding on a wide variety of programs aimed at helping county citizens protect themselves, their loved ones, and their community against COVID-19. One of our first priorities was understanding how fast COVID-19 was spreading. To do that, we created a community testing program. DPH secured several testing partners who would provide testing kits and lab services. DPH administered tests throughout permanent sites and community pop-ups across the county. These DPH facilities provided nearly 36,000 COVID-19 tests.
DPH built a drive-up testing infrastructure in the spring of 2020 with a focus on providing testing services that were free and that were easily accessible for all residents of St. Louis County, with a particular focus on geographically spreading testing locations in places that where people might not otherwise be able to access testing or healthcare resources. We have built a COVID-19 testing lab within the health department and also have a forward-facing patient portal so that patients who are tested through DPH can receive their results in a timely manner electronically, or certainly by phone call if that's a preferred method for them.
Another priority was to arm our community with masks and other protective gear, or PPE. DPH immediately jumped into the competitive marketplace to source and purchase more than 4 million masks and other PPE. Focusing on those in highest need, we engaged in local governments, social service agencies, and many other organizations to get the masks on the faces of our residents. We partnered with the County Department of Human Services to get masks to the unhoused. We distributed masks at food giveaways. We gave 100,000 each to the Regional Response Team, the Archdiocese, the Urban League, and the Clergy Coalition. We even had a drive-thru event for the public.
Well, we were extremely excited about the opportunity to partner with St. Louis County Department of Public Health in making sure that our citizens could adhere to the mandate that was given out. Because we knew one of the impediments for our community is having access to the PPE. We did 17 days straight of COVID testing, and we gave out masks to participants, but they had the COVID-19 kits, which were phenomenal. So they got a mask, they got a hand sanitizer, and what I loved was they got a pamphlet to make sure that they knew the pros and cons of COVID testing and COVID disease overall. So we really appreciate that. And the partnership we've had with the Department of Health has been very beneficial for this community.
Finally, we created 2 information campaigns to educate residents about how to stay safe during the pandemic. The Be a Hero campaign highlighted residents of color using their superpowers to fight the spread of COVID-19 by practicing safe behaviors like wearing masks, avoiding crowds, and washing hands. At the same time, we hired a local firm to create and disseminate a second campaign, Masking for a Friend, aimed at answering the questions of individuals who needed more information about COVID-19 and the behavior necessary to stop the spread.
Being part of the Be Heroes campaign was really cool. I got to promote healthy living, and it's just saying that everyone can be a hero by doing these simple things like washing your hands, wearing a mask, and social distancing. You can be a hero and help protect others and yourself. And it was fun to see my face on a bus too, and a billboard and some bus stops. So I got to see myself on a bus.